So for this morning, I will just be giving a short lecture on how to recognize common allergic conditions. So as we all know, allergies are very common among our patients or among the population. What are allergies? We know allergies to present as the following. First is parang wheals or hives. Some of you would know it as taglabay. So yung mga terms that we use for that. And then it could also present as angioedema or swelling of the mucous membranes of the eyes. And also the persistent colds, or what we know as rhinitis or allergic rhinitis. And of course, we also have asthma. So worldwide, there is a rising prevalence in the number of allergic diseases that we see. Allergy to one or more of the common allergens among children are currently approaching 40 to 50% prevalence. It has 300 million globally. There's the prevalence of allergic diseases, which is perceived to reach around 400 million in 20 to 25 years. Annually, there's an average of 250,000 deaths. And so these are just the common allergies. 400 million suffer from allergic rhinitis. And for the skin asthma or atopic dermatitis, it is known that there's 15 to 30% lifetime prevalence in children. And most of which would occur, or its onset would develop during the first 6 to 12 months of age. And there's also 200 to 250 million suffering from food allergies or adverse food reactions. So what is an allergy? Allergy is an immunologic response to an environmental allergen. The response could be tissue inflammation or direct organ dysfunction. What is an allergen? An allergen is any agent that would cause these reactions. So some of the known allergens are the following. First is, of course, in food. So most of the patients or most of you would immediately recognize, immediately point out to a food allergy, especially if the reaction would be rashes. Another would be pollen. So pollens would come from either the trees, flowering plants, or yung mga common na grass and weeds. So we see all of those around us. And of course, animal dander. So we also have, we get it from the hair of cat, dogs, and feathers ng birds, and the different or some specific drugs or medications. Another example of an allergen would be those that would cause direct contact. So an example would be sa gloves, surgical gloves, because of the latex. So that would be latex allergy. And this is actually the most common allergen, yung dust mites. So it is around us, but we don't see them because they are microscopic organisms. So yung mga dust mites, where do we find dust mites? They are usually in areas, sa house, in schools, or yung mga workplaces where where the dust gathers. So for example, at our houses, usually sa mga bed sheets, curtains, mga carpets, yan, nandiyan yung mga dust mites. And how do we get these allergic reactions or these allergies? So again, we saw earlier in different allergens. So how does the allergy happen? It could be first due to skin contact. So for example, yung mga plants or pollens, animal hair or dander, and yung latex or direct contact with the skin. We can also get it through injection. So an example would be yung bee sting, so, or insect venom. So diba, yun yung it could cause an allergy. And also, medications or drugs that are injected, so yung intravenous drugs. Could also happen through ingestions, yung mga medications, and again, yung food. And of course, lastly, is through inhalation. So for pollens, yung mga molds, and animal dander. And yung dust mite, which I mentioned earlier. So atopy is the inherited propensity that some people would have that they react immunologically to allergens. So it is said that genetic yung mga allergic diseases. In fact, for the two of the most common allergic diseases, the allergic rhinitis and bronchial asthma, if both parents are atopic or are allergic, there is 40 to 60% chance that the child will also have an allergy. And for example, if one parent is atopic, there is 20 to 40% chance that the child will have an allergy. So common siya, and it is genetically inherited. This is what we call the allergy march or the atopic march. So usually, there is this trend, or we can see at what point or what stage in life a specific allergy would occur. So for example, during the infancy or the childhood stage, we mostly would observe or would note emergence of the atopic dermatitis or skin asthma, including also food allergies. Eventually, during the childhood or late childhood, early adolescence, we would note asthma, or the increasing stage, so asthma, followed by allergic rhinitis. So the atopic march does not mean that one patient would have all these diseases, but this is just the observed pattern of occurrence of these allergic diseases. So again, because of genetics or the genetic predisposition, plus the environmental exposure and the immunologic response of the body, an allergy occurs. And what are these common allergic conditions? These are just some that we see often every day in the clinics. So we have allergic rhinitis, asthma, atopic dermatitis or skin asthma, food and drug allergies, and the contact dermatitis and anaphylaxis. So I will just mention each one briefly. So for allergic rhinitis, we want to recognize these common allergic conditions. So allergic rhinitis, this would present as rhinorrhea or colds. There's sneezing, nasal congestion, nasal pruritus, or nasal itchiness. And there would also be itchiness of the conjunctiva, its eyes, so mati, sa namumula, and there's excessive tearing or nagluluha. So this is just like the common colds. But what would differentiate it from an allergy or allergic rhinitis is that allergic rhinitis would be more persistent and chronic. So even without yung mga fever, which we would observe in the usual viral infections or viral illnesses, in allergic rhinitis, usually there is no fever or there is no evidence of an infection. Another is the allergic asthma. So asthma is inflammation of the airways or the lungs. So what happens is there is wheezing or difficulty of breathing, chest tightness, and coughing, usually dry cough siya. So again, what would differentiate it from the common cough or yung mga viral cough? So there is no infection, so walang fever, and we would note this to be persistent. So balik-balik siya. Usually the patient or the parents would come in saying that palaging luwi anak, so kahit daw nagbigay na ng mga antibiotics, bumabalik pa din. So usually if that would be the symptoms, you would think of an allergic asthma, an allergy. And usually the parents would note certain triggers. So kailan yung madalas na inuubo? Usually they would say, pag malamig yung panahon, or minsan din kapag kunwari nasa labas, pagpasukan. Iba naman, for younger kids, for infants, some would note that kapag daw tawa ng tawa yung baby, after tawa ng tawa, biglang hinihingal na. So usually that is asthma. And then this is atopic dermatitis, or what we know as skin asthma. So what happens is that there is severely dry and scaly skin. So sobrang dry yung skin, patient, and then there would be pruritus or yung itchiness. What happens here is that this is a skin disorder, inflammation again of the skin. So usually this is also triggered by certain allergens, usually food and yung mga inhalant allergens natin. This would happen also in certain areas of the skin. So like for example, for infants, yung mga babies na rosy cheeks, minsan yung mga rosy cheeks, pag tinitigan nyo, di pala siya pinkish, rashes pala siya. Yung feeling rose niya would be rashes, and if you look closely, minsan dry na dry skin. So for babies na medyo rosy cheeks yan, medyo mag-isip na kayo, baka meron pala siyang atopic dermatitis or skin asthma. And then as they grow older, so for older kids and yung mga adults, usually naman we would note the dryness of the skin and the rashes dun sa mga flexural areas, like for example, sa neck and sa arms, and you would note it to be darkened na or hyperpigmented yung skin nila. So sobrang dry, and then nag-darken siya. And this is the food or drug allergy. So these are allergic reactions to certain food and medications. This can affect any part of the organ of the body. So usually, rashes din siya, or angioedema, yung may swelling of the eyes, of the lips. Some would also manifest as yung difficulty of breathing. So parang yung mga previous examples din natin. This would usually manifest within seconds to hours after the intake of the food or the drug. And some would have a delayed reaction, meaning pwedeng a few days after taking the drug or the food. So meron tayong mga delayed reactions din, especially with food and drugs. And this is what is known as contact dermatitis. So what happens is that there is an allergic reaction to a material that is in direct contact with the skin. So ito, example, kasi marami tayong nakita na ganyan. Yan. So yan, saan siya allergic? Sa chinelas. So dun sa rubber, specifically rubber slippers, so dun sa rubber. So we would note that na it follows the shape of the object that it came in contact with. So yan yung example niya. And usually, there is a prolonged exposure to that material, and this is one of the examples of delayed reaction. So it happens, or you would observe it a few days after the contact with the skin. So lastly, this is probably one of the this is the most severe and possibly fatal na allergic reaction. It is called anaphylaxis. No? So in anaphylaxis, again, this is a serious allergic reaction that is rapid in onset and can cause death. So usually this happens a few seconds or a few minutes after exposure to the allergen. So what happens in anaphylaxis? These are just the common signs and symptoms. So what is most common would be the appearance of urticaria, or yung rash, yung kanina nakita natin, and angioedema, yung swelling of the eyes, of the lips. And this is also associated with other signs and symptoms. Most commonly, upper airway edema and dyspnea. So aside from the rash, nahirapan din siyang huminga or para siyang hinihika. So ma-observe nyo yung patient na ganyan yung manifestations nila. Some other reactions would be flushing or yung redness, generalized redness of the body, dizziness, and some would experience vomiting, diarrhea, nausea, and the rest. So yan yung mga other not so common na symptoms, but most commonly urticaria, edema, and dyspnea. So what happens, or what do we do if we have see someone having anaphylaxis? So syempre, if it's the first time, difficulty of breathing, and then may mga rash, syempre diretso na yan sa ER because the proper medications will be given sa emergency room. But what do we do pag nasa ER na? We give epinephrine. So this is, epinephrine is actually the drug of choice for anaphylaxis. And we inject it intramuscularly sa thighs. This should be given immediately because, as I mentioned earlier, it could be fatal. For some patients who already have a known reaction, or kunwari nagkaroon na ng mga previous anaphylactic episodes, we prescribe them with the epinephrine. So if you see it, usually sa mga movies, kasi wala tayo dito sa Philippines, yung EpiPen. So they have that. The patients would have their EpiPens with them anytime. So alam na nila yun na kapag nagkaroon sila ng anaphylactic reaction, inject na nila yun sa mga cellula nila. For us here, locally, we can see your allergist, kasi some would be able to procure your EpiPens for you. But what we do have here in the Philippines is the epinephrine vial. So, ano siya, mano-mano siya. So we will break it, give it just that, and then we have the syringe So tayo yung kukuha nung sample and then we inject it to our sa thighs, intramuscularly. So we prescribe this to our patients because anaphylaxis may happen again. So it could recur, especially if magkaroon ulit ng exposure with the allergen. So when do we see an allergist, or when do we advise someone to see a doctor or a specialist? First, if there is any experience of asthma or yung mga allergic conditions or yung symptoms that I have mentioned earlier, in association with exposure to certain allergens. Another reason would be if there is already a limitation in the diet. So most of our patients would come to us saying na wala na raw silang makain. Or usually mga bata, mahirap na for the parents na magpakain kasi hindi nila alam kung anong bibigyan nila. So with that, you have to see an allergist kasi we need to confirm if the reaction is really an allergy. So kung meron talaga kayong allergy to those food, to certain food. And of course, if there's a history of a severe reaction such as yung anaphylaxis. So pag meron na mga yan, you have to go and see an allergist or suggest to someone to see a specialist. So what do we do in the clinics? So for us, if you see an allergist, we first, of course, confirm if it is an allergy. So this is just one of the things that we do. We do the skin prick testing. So yeah, we confirm kung saan nga allergic. So we give you prick yung mga allergens. So we have a set of those most common allergens. So we have pollens, indoor allergens such as dust mite, cockroach, animal dander, animal hair, and yung mga food. So we have yung mga common food and we test it to the patients. Aside from this, there are also other laboratory tests that we request, pwede rin blood test to check for the specific allergens. Yung IgE testing, yung important. And sometimes you also, in the clinics, you also try to rule out all the other possible diseases that would cause yung mga reaction. So, yun yung mga ginagawa natin sa clinics. But once the allergy is confirmed, so kumari, alam na natin, na-confirm na natin through the laboratory testing, through skin testing, that the patient has an allergy, what do we do? So we have 4 major principles in managing allergies. First, of course, is to avoid the allergen. So kaya important na ma-confirm yung allergy, yung allergen is because we need to avoid those allergens. So how do we avoid it? So yan, di ba? Anong pwedeng allergen siya? Yung mga dust mites. So siya yung sa mga stuffed toys, yung sa carpet, sa beddings. So how do we avoid this? So specifically yung mga inhalant allergens natin. So again, we have to remove yung mga dust gatherers. So yung mga areas na nag-gather palagi ng mga dust, yan palagi dapat natin nililinis. We wash the blankets, beddings, curtains, or covers in lukewarm or hot water every 2 weeks. Actually, for me, I advise our patient na kung severe to wash their beddings every week or to change the beddings every week. And it is advised also that you use yung damp cloth or yung wet mop instead of yung usual na feather dusters or yung mga pagwawalis, because in doing that, pag hindi wet, parang nakakumakalat lang yung particles, yung dust particles. And of course, you have to keep toys, clothes, so yun na yung mga books, usually also books, inside closed cabinets. It is also important for us to close yung mga windows and doors, especially if the allergy is sa mga pollens. Kasi hindi naman natin maiiwasan na ma-expose tayo sa pollen, especially pag nasa yung subdivision na may mga vacant lots, so we have to close the windows and the doors. And it is also important to avoid irritants. So ano yung mga irritants that we have? We have yung smoke, so we have to prevent smoking and pollution. So these are not allergens, but they exacerbate yung mga allergic reactions natin. So yan. And it is everywhere. It is around us. We also have to remove sources of damp areas to prevent yung mga mold formation, and we have to decrease humidity and temperature. And if you have food or drug allergies, so syempre avoid the food. You have to know which specific drug or food you are allergic to. It is important that you read the labels properly, both for food and yung mga iniinom natin, yung mga supplement, because some of the ingredients would have yung substances that you are allergic to. Minsan hindi natin alam, akala natin okay lang kayo. But if you read the labels closely, makikita nyo meron palang ingredient na yun. So in some countries like in the US, very strict sila. Nakalagay talaga yon sa mga labels. Common kasi sa kanila yung peanut allergy. So usually, nakalabel talaga yon. It may contain peanuts. Or kung wala siyang peanut, nakalagay din doon if the product was produced in an area na gumagamit din ng peanut. So very strict and specific. So you have to read those. And of course, you have to inform your doctors and yung family nyo rin and close friends kung saan kayo allergic. Some would even have yung parang mga tag para alam kung saan sila allergic, lalo na yung mga nagkakaroon ng mga severe reactions. And again, aside from avoiding allergens, we also have the common medications. So usually, in most of the allergic diseases, dalawa yan. We have the relievers and the controllers. So yung reliever, yun yung mga immediate na medications that we give to relieve the patient of the symptoms. So for example, yung antihistamines natin, we give it to our patients. Some of you would also use it kapag may mga allergic reactions. And the others, yun yung mga controller medications or para mga maintenance. Like for example, for patients with allergic rhinitis, we give, kung severe, we give steroid nasal sprays. For asthma, we have yung mga inhalers. And for skin asthma, yung mga topical, yung mga steroid ointments. So again, the allergist will be able to prescribe to you. And we also have what is known as allergy shots or immunotherapy. So this is the closest to a cure that we have for an allergic reaction or for an allergic disease. So what happens is that we try to induce tolerance to certain allergens. So most commonly yung dust mite. So ini-inject yan dun sa patient. Kaya siya allergy shot. So para siyang vaccine, parang ganyan. So allergy shots, we give it at a certain time, weekly, and eventually monthly. The patients will get their allergy shots, really allergies. And we do it for around 3 to 5 years yan. Na regular, monthly, binibigay sa patients. So what it does is that it allows long-term control of the allergies. Specifically, we do this for asthma, for allergic rhinitis, and for skin asthma or atopic dermatitis na meron talagang positive sa skin test na reaction. So yan yun, immunotherapy or the allergy shots. At present, we have, kasi ito being injection, but you already have yung oral na immunotherapy. So it's already available here in the Philippines, so through the allergists. And again, we of course do continuous patient education. So we always advise our patients how they will be able to manage or control their allergies themselves. And this includes, of course, yung na-mention kanina, yung mga awareness, na pag-promote ng awareness to also to all the people, kasi nga this is already a very common disease. So it's important to know when to consult your specialist and how to recognize yung mga allergies. So yan yun. So continuous allergy education among the lay and among the patients. These are just some, before I end, these are just some of the probably mga misconceptions about allergies. So first is, kung narinig nyo na yun, yung hypoallergenic diet. O yung kapag kunwari, magkaroon kayo ng mga rashes ng kate, ano yung una nyo gagawin, di ba? Sabihin nyo, hindi kayo kakain ng mga malalansa. So ano ba yung malalansa? Hindi ko rin po alam kung ano yung malalansa. Kasi we actually do not advise a hypoallergenic diet. Why? Because an allergy is very specific. So hindi porket nag-react kayo, kunwari, to fish. It doesn't mean that you're already allergic to all the other food. Kasi iba gano'n, may allergy na sa fish, so hindi rin sa kain chicken, hindi na rin kakain ng egg. Diba? We have the common food allergens, so we have milk, peanut, eggs, peanuts, soy, wheat, certain fish, and yung shellfish, so yung shrimp and crab. So these are the common food allergens. But it does not mean na iiwasan nyo lahat yun. Unless there is a very severe reaction and hindi pa kayo makapagpa-check o makapag-consult agad. That's when you have to be careful in your intake of food. Pero hindi naman yung hindi na kayo kain kasi yun yung mga nangyayari sa patients. Usually, they come in, nangyayari na kasi sila, dahil silang makain. So, hindi totoo yun na there is a hypoallergenic diet or yung mga malalansa. So, what you do is, again, consult the allergist and have yourself tested kung saan kayo talaga allergic to food. Also, there is no hypoallergenic pet or hypoallergenic cat or dog. Kasi marami rin kaming patients na ganyan, pupunta, and then positive kunwari sa dog, and then sasabihin, pwede po ba yung dog na to? Kasi may certain breed, kasi raw wala masyadong balaibo. So, hindi yun hypoallergenic. Kasi, what causes the allergy ba? Usually, can be found in, hindi lang naman sa hair. Could be found dun sa urine, sa saliva, and yung sa skin nila mismo. So, hindi lang dun sa hair. Okay? So, walang hypoallergenic cat or dog. So, pag allergic doon, yan, tanggalin ang cat or dog. And, ito, eating a lot will cure my allergy. So, usually, pag sinabing allergic sa shrimp, ang gagawin ng iba, kain daw ng madami. Para daw mawala yung allergy or ma-desensitize. So, hindi po totoo yun. Kasi it could, diba nga, sabi ko kanina, it could be fatal. So, pwedeng maging severe yung reaction. So, kung proven or kung confirmed na yung allergies nyo, like for example, allergy nga sa shrimp, you have to avoid, part yun ng management natin. You have to really avoid that food. Kasi nga, baka may severe na reaction. Kasi it happens, minsan nga, habang nag-react kayo, imbis na ma-desensitize or mawala yung allergy, magiging mas severe pa yung reaction. So you have to be careful. And here, allergies are outgrown. This is partially true because for some allergies, especially if the allergies would occur sa younger age, there are some allergies that they would outgrow. Like for example, milk allergy, egg allergy, and usually, pag bata nag-start or pag baby nag-start, may iba na outgrow siya by 1 year old, by 2 years old. But in general, or mostly, allergies are not outgrown. So usually, meron pa rin yan. Sabi ko nga kanina, there is really no complete cure to an allergy. But, of course, definitely, we can control our allergies. Given yung mga proper medications, treatment, and if you also regularly consult your doctors, we will be able to control the allergies. And that's it.